You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is considered Tennessee's go-to implant dentist, Dr. Johnny Shanks. Dr. Shanks, welcome to the program.
Thanks for having me, Randy. I appreciate your time and looking forward to the show.
Well, good. Now, I know you brought a lot of photos, so we'll try to get to as many of those as possible.
Yeah.
Now, for people that don't know your practice, like who's the typical dental implant patient?
You know, Randy, we really don't have a typical dental implant patient, but they really come in two different types.
Okay.
You know, our first patient is typically a denture wearer, and they've been wearing a denture sometimes for many years, sometimes very recently.
Okay.
So for these denture patients, you know, those patients are pretty tough to get in the office.
Okay.
They've adapted. They've you know, really pretty much adapted to the denture. So, you know, our ability to give them upper lower teeth that don't come out, give them quality of life, give them back their confidence, their ability to chew, function.
Okay.
You know, the ability to see themselves in the mirror and have that self-confidence.
So on the day of the procedure, they can walk in without teeth
Yeah.
and walk out with upper and lower teeth that don't come out. Is that right?
Yeah, the day of the procedure.
Like if you started today, tomorrow they'd have their teeth.
That's it.
Is that right?
That's it.
And that's common in your practice.
Pretty common.
Okay.
Now, a lot of that is due to the advancements in technology. You know, the 3D printers, the technology that allows that to really happen, but very routinely our patients come in.
So what about the second group of patients?
Yeah, these are patients, Randy, that have teeth. They've got bad breath, a lot of pain, a lot of bleeding gums, a lot of issues with their teeth. And, you know, they maybe been a few places and said, hey, you need to go into the denture, you need to go into this style.
Is that right?
Yeah. And knowing what we do, you know, they come to us, we're able to.
Because they don't want a denture. That's why they go to you.
Patients don't want dentures.
Okay.
They really don't. And so they come here and we're able to give them some options on upper and lower teeth that don't come out.
Is that right? Supported by dental implants.
Supported by dental implants.
Now, how old can you be to get this done? Is there an upper age range?
Well, I'll tell you, Randy, I've got a patient, you know, a few years back that was 92 years old and you know, went through some of those same circumstances, you know, broken teeth, bad breath, some gum infection. She had some teeth that were missing. And you know what she told me?
What?
She said, you know, Dr. Shanks, I came into this world with all my teeth, and I'm leaving this world with all my teeth. And she went with upper, lower teeth that don't come out. And, you know, from that time period on, she lived a healthy life, was able to chew and function. And
she
really,
can eat whatever she wants?
Yeah, apples.
Now, why would a 92-year-old, though, want to do it?
You know, Randy, and that's the thing. For her at 92, I mean, she still had a lot of life left. You know, when patients come in that are maybe closer to 70, 73, man, those type of patients have a lot longer.
So they think they're too old sometimes? Like a 72-year-old says,
too.
Doc, am I too old?
Yeah. And so they have a plenty of life to live. You know, this type of procedure allows for a better quality of life for those patients. Absolutely.
So that 92-year-old lady.
Yeah.
So what'd you do for her? Exactly. You gave her upper and lower teeth, like supported by dental implants.
Yeah. Yeah.
And she could eat whatever.
Yeah. So, you know, went from, you know, pain, infection, bleeding, to, you know, upper, lower fixed set of teeth that don't come out.
Okay.
And, you know, able to blow out the candles with her daughter.
Okay.
And not have to worry about her teeth flying into the cake.
So aren't they more likely, like the dental implants, to come out if you're 92 years old? Are there stats on that? Or?
Yeah, so, you know, if a patient can walk in the office and we evaluate our x-rays, you know, for the most part, we can help pretty much any patient regardless of age.
Is that right?
Yeah.
And so when we say no more dentures, is that the future of dentistry as you see it? Like whether it's 20 years or 50 years, dentures as we know them today will be gone. They'll all be attached to something?
Well, you know, Randy, that's my mission.
Okay.
My mission is to really help patients that may feel like there is no solution to really regain back that quality of life. So upper lower teeth that don't come out, man, it's a fantastic option to patients that feel like they lost hope. They're in pain, they have infection, they've missing teeth, they've lost hope. Fixed teeth that don't come out, gives them that quality of life that they're looking for.
Now back to the denture wear for a moment, but isn't it true if you've been wearing a denture like 10, 15 years, you can't do this, you don't have enough bone?
Not true at all. And so I've got, multiple patients that have worn dentures 20 years, 30 years, 40 years. And, I hear this a lot that, hey, I'm not a candidate, I'm not a candidate specifically due to the bone. And it's just simply not true. That we've got all kinds of techniques now, specialty implants. And, we can pretty much help just about anybody, Randy. I had this one patient that came in and was told that they didn't have enough bone. And so
by another dentist.
By another dentist. We went through the evaluation. Doctor, are you sure I have enough bone? And I said, man, you do. And so we were able to take that denture wear, 20-year plus wearing a denture, use some specialty style techniques and implants, and we're able to give them upper and lower teeth that don't come out.
So this is your focus in your practice. Like you don't do fillings or veneers or crowns or things like that. I mean, mostly what you do is implants?
Yeah, so, as tough it is to get people to come to the dentist, I was an early pioneer in sedation dentistry.
Okay.
Been doing sedation dentistry now for over 10 years. So our focus really is implants, specifically sedation dentistry.
So you're big on sedation dentistry.
I'm a big fan of sedation dentistry. I mean, patients come to us because they don't want to remember the dentistry, the procedure. And so they literally can come in, get what they need done, and not remember a thing.
But it does seem painful, this procedure.
Randy, these patients are sedated.
Okay.
And so they're numb, they're sedated, they're not remembering a thing.
Okay.
And so...
What about the next day?
Even afterwards, with the pain level. Some of these techniques that we use allow for reduction in post-op pain. So I had this one patient, we called to check on the patient post-op. They had zero discomfort, zero pain.
Right. So there is discomfort, but it's always, they worried about it more than they should have.
Exactly.
Is that right?
Exactly. They worry a little bit more than they should. And I'm quite honestly, most patients say that the post-op pain is very minimal.
Is that right?
That's right.
Now, I think you said that in some cases for the maybe some of the dental phobics or they're really worried about it, you can give them like a pill to help them the night before to sleep.
Well, these patients, Randy, are terrified of the dentist. When they go to grab the door handle, I mean, they're shaking. So very simply, give them a little pill before the procedure, settles everything down.
Okay.
That allows them to get comfortable, kind of come into the office and kind of get connected. And from then on out, they don't remember the procedure.
Now, by the way, dentures or people that are headed to dentures, is that a big problem in your state, in Tennessee?
It absolutely is. And I think a lot of it is that patients don't really understand or know that they have other solutions.
Okay.
Solutions specifically to whether it's a patient who's just recently received a denture or got a denture. Normally those patients have quite a bit of bone. But there's also some new advanced techniques that even a denture patient that maybe has worn a denture 20, 30, maybe even 40 years, there's some advanced techniques now that allow us to help these patients with what they thought was minimal bone.
Okay.
Get upper and lower set of teeth that don't come out.
How soon can they eat after it's all done?
Yeah, they can eat that night, Randy, right after the procedure. Now, obviously, we communicate to them to be careful and eat some soft foods initially. Okay. But before you know it, bang, here we are at the steakhouse. Here we are at, eating an apple, eating corn on the cob. I mean, it really transforms, the patient's life.
What kind of eating stories do you hear? Like, what is it? Mostly the steak, or is it more of the vegetables? What is it?
Well, mostly steak. I mean, can you imagine trying to chew a steak with a denture? I mean, this thing's wobbling left and right. And so for those patients that go with, upper lower teeth that don't come out, I get those stories all the time. I had a guy come in and say, Dr. Shanks, I tested it. I said, what do you mean I tested it? And he said, I went to the steakhouse and had prime rib, and man, I just want to thank you for giving me that confidence to have a good steak at the steakhouse. So it really changes that patient's outlook on life.
Now, what do they like more, the way the new teeth look or what they could eat? Or is it a combination of both?
It's a combination of both. What I see with patients, especially from the aesthetic side, is it gives them permission to be who they really want to be.
Okay. What do you mean by that?
Well, a lot of these patients are hiding behind their smile, whether it's a mustache. I had a gentleman that kind of came in looking like Duck Dynasty.
Okay.
He's got the huge beard and the mustache, and everything's covered. And I realized, Randy, that these patients may not have something to smile about. And so when you give a patient, upper lower teeth that don't come out, man, it's confidence in a bottle. And they're able to really look at themselves in a totally different light. A lot of what these patients are dealing with is the psychology of this is a little bit part of this.
What do you mean?
Well, a lot of what they're remembering is the past.
Okay.
They're feeling, they feel a lot of just anxiety around, I should have done it better. I should have taken care of my teeth better. And we need to give them a reason to live for the future. And every time they look in the mirror now, when they see that smile, that's permission.
Okay.
That's permission for them to be who they're destined to be.
Wow. Would you, now, in the state, I'm talking about the state, would you say there's more than 10,000, 100,000 people that have an upper lower denture, or another 100,000 that are headed to a denture?
It's probably more than that, Randy.
Is that right?
Oh,
it's a big thing.
It's a big thing. And I think a lot of it is, purely patients don't really know the options out there.
And I chat GPT'd this, and there's 50 million people in the U.S. with an upper lower denture, right? So that's a lot of people. So what's your take, and in Tennessee, hundreds of thousands, why aren't they doing this? If it's so good to get new teeth with implants, what's your take?
Number one, they probably don't know their options. B, they think this is too expensive. One of the things when they look in the mouth, they think, man, 32 teeth, I've got to get an implant on every tooth. Well, it's not so. We can put four implants on in the jaw and put a whole set of teeth.
All right.
So that's that. Age. They think they're too old. They've been told by.
And you said 92-year-olds are doing this.
Yeah. So they've said in the past they've been told that they're not a candidate, and so that's a thing. So those are the things that are really keeping these patients from moving forward. Another thing is they think it takes forever. I've heard a patient that went through this treatment and took 2 years. Randy, with the advanced technology we have now, the 3D printing, the milling, we can get this done in a very quick order.
Now you told me in the old days it was lots of bone grafting, and today it's very little bone grafting. Why?
Very little.
What's changed?
New techniques, new technology that allows us to see.
Okay.
New techniques that allow us to place specialty implants in the bone to anchor to. And so, this, 10, 15, 20 years ago, this, really wasn't an option.
But they're still doing it that way. We talked in the green room where it still happens where this is typically done in two different places. One place for the surgery, another place where they put the teeth on top, and then they send everything out to a lab, and at your office, you just do it all right there. Yeah, logically, it makes sense if you're going to do this to kind of find a person that does it that way. And I'm not trying to side with you.
Well, the way we do it is, you're right. You had one provider that would refer to another, and then you would have the dental lab, and then you would have the restoring doctor.
The one that makes the teeth.
Yeah, that makes the teeth. And so, in our office, we just combined that all. So what it allowed us to do is really give value to the patient.
Okay.
And so not only am I going to place the implants, I want to do the smile design. I'm going to create and manufacture the actual teeth. And I'm also the restoring doctor. And so.
Which means what?
Which means I'm actually going to install the teeth that you're going to use to chew.
And even in Tennessee, where you are, that's not how it's typically done.
Not typically.
Okay.
Not typically.
You go to several places.
Several different places.
And it costs more money that way.
It does.
Is it?
It does.
Oh, it does?
It does.
So it's one doctor, one fee where you are.
That's right. You know, and when you have multiple people involved, fees a little more in the time. So by bringing in these technologies under one roof, we're really able to take better care of the patient.
I'll put you on the spot. Are you one of the most? Because you told me this, I think.
Yeah.
I'm paraphrasing, but I mean, you're doing it at the highest level, or in your state. I mean, you have all. I'm calling it bells and whistles, but all the technology, all right there, and there's really not a lot of other people that have more than you do.
That's right.
Is that true?
That's right.
I even asked you before we went on. You have these mills that make the teeth, like several of them.
Yeah.
I go, do you need that many?
Yeah. Well, from facial scanning, actually scanning the patient's face to do a smile design in real time, to intraoral scanning, to 3D printing, to titanium milling. We're 100% vertically integrated from a manufacturing standpoint to really help patients under one roof. And that's the advantage that we can really help and create value for the patient. So let me go back to facial scanning. Really interesting part about facial scanning is it allows us to capture the patient's face. And because of that, we're able,
like in the 3D way?
Yeah, like on a computer screen.
All right.
So once we capture the patient's face on the computer screen, we're able to design, really based on the patient, custom design. So an 80-year-old man gets a different set of teeth than a 45-year-old lady.
Okay.
And so a custom approach really allows individual results.
So they look more natural in their
absolutely.
mouth? Like when they smile, it kind of fits their mouth?
Absolutely.
Okay.
And it allows us to really get predictive success on the design of the smile. So there's a lot that fits into smile design. Just the line in between the teeth, that has to match up. We call that the midline. It has to match up in the middle of the face. How the smile follows the lip. It needs to curve.
And you wouldn't be able to do that as well without that technology.
Absolutely.
Not a lot of guys have that?
Not a lot of guys have that. And specifically, it also allows us to kind of build the bite in a way that's comfortable for the patient.
Okay.
And so those technologies really allow
Very nice.
us to really nail a beautiful smile.
Now you brought some photos. Let's take a look at that.
Yeah.
What are we looking at here?
Yeah. So this guy right here came to see me.
All right.
Awesome story.
That's got to be unusual to have teeth that bad.
Randy, it really isn't. These patients are covering their smile. You don't even see it. And so, that looks, pretty bad, but really it's pretty common.
Okay. Do they ever say it too? Like, Doc, this is the worst you've ever seen?
Absolutely. And of course it never is. So what do we do for this guy? He's got a lot of decay with all the teeth. We put in 6 implants in the upper jaw, attach a brand new smile to the implants that don't come out. And as you can see in the after photo,
wow.
Yeah, it's a big change. Now, what's interesting is the story.
Okay.
So this guy, I mentioned Duck Dynasty, he literally looks like he's got a beard covering his teeth. So when we go to the after, his whole story changes. Randy, he starts to date again.
Okay. That's what he tells you. Okay.
He starts to date again.
All right.
Soon thereafter, he gets married.
Okay.
And, a year and a half later, he's got his first child on the way. Got a promotion with his job, feeling confident about his smile, able to chew and function and eat the foods that he wants. Obviously, the smile is fantastic in that change from before and after.
Yeah.
But it's really the change on the inside that we can see.
So his charisma comes back?
Charisma, confidence. The guy gets the guy's got a great job. He gets a promotion. The guy gets married, has a family, comes in, new hairdo. Guy looks like Duck Dynasty, and he comes in looking like James Dean. I'm telling you.
Okay, very nice.
I'm telling you.
And so this is like a common thing in your practice.
Absolutely.
These big transformations.
Absolutely. And, you know, man, Randy, when you give somebody a smile, it gives them permission to be the best version of themselves.
Now, before with those teeth, he couldn't eat very well.
No, he was in pain. You know, you can tell by the photos, his gums were irritated. He had some infection, a lot of decay with the teeth. When you have, you know, teeth like this, I mean, apples, almonds, you know, biting into an apple, even biting into a sandwich.
You can't do.
No. You know, cutting fishing line, man, you can't do that.
So you could cut a fishing line with the new teeth.
Absolutely.
Do you warn them not to do that, though?
Yeah, we tell them not to do that.
But they're going to do it anyway.
They're going to do it anyway.
Okay, good.
Yeah.
So some more photos.
Yeah. All right, so I've got this guy here. A little different scenario. You know, knew he had issues. But, you know, what do we do when we have issues? We kind of kick the can down the road, right? So
Put it off.
We put it off.
Okay.
We put it off. So
especially men, they only come in when they have to.
Have to.
So a front tooth gets broken.
Front tooth
now
is
they
broken.
come in.
Now he's like, all right, it's getting to the point where I've got to take action. It was probably his wife that sent us our way.
Okay.
You know, a guy like this comes in, missing front tooth. His teeth are hopeless. Comes in, he's fearful of the dentist.
Yeah.
He doesn't have any solutions. Gets a consultation on a denture. He doesn't want that. He's got a gag reflex. Comes to our clinic. We talk about, you know, upper lower teeth that don't come out. Boom, done. Got him fixed up.
Looks good.
Now, you look at the photo. Is this guy smiling around town?
Yeah. Okay. Okay.
So, you know, able to function, able to smile, able to regain quality of life, and that's what these patients are wanting.
So what is the process? So you said there's two main categories. Those people with really bad teeth and gums, and they don't want a denture, or people that are currently wearing a denture.
Yeah.
So what's the process to get to those teeth that don't come out?
First step is a consultation in our office. We're going to take some x-rays and evaluate if the patient is a candidate for dental implants. We're going to give them some options.
Okay.
Let them see kind of what options are available. From there, we go into really the second piece is digitizing the patient. So we actually take a full facial scan of the patient. That allows us to put their face on a TV screen. That way we can really customize a specific smile for them. After we're done with the smile design process, the next step is the procedure. So they get a brand new set of teeth, you know, the next day.
So it's 3 steps.
3 steps.
Now, I put you on the spot in the green room. I said, like in a perfect world, how soon could you get this done? How many appointments? And you said just 2 appointments.
Yeah, 2 appointments. Absolutely.
Is that right?
You know,
because you have the lab, because you make the teeth right there. Is that right?
Yeah, it's a fully digital workflow. We've got the lab, the 3D printing. We've got the mills.
And mills and 3D printers, and that's where you make the teeth.
Yeah.
And you have somebody, painting the teeth?
We do. And so those are pieces of equipment that allow us to create the smile within a very short time.
Okay.
And so we're able to deliver the brand new smile within the next day.
So if somebody's watching this and you had availability on your schedule, really bad teeth and gums, or maybe a denture, they could have their teeth next week. Is that right?
Absolutely.
Okay.
Absolutely. That next week.
So time for another photo.
Yeah, here we go. So this patient comes in. This patient actually plays a saxophone, of all things, and is active in his church, and ultimately some of the front teeth were breaking off, and he knew he had a big problem. Didn't want to come see us. He's afraid of the dentist. His wife made the appointment, by the way.
Okay, is that common?
It's common.
Okay.
We see that a lot.
They get sick of them complaining about their teeth, and they just make the appointment for them. Okay.
Yeah. So, this guy's facing a little bit of issues here. I mean, he's got a lot of teeth that are loose, a lot of teeth that are broken down. His bite isn't good. He's afraid of the dentist. He knows he's got an issue. He's been kicking the can down the road for a long time.
When you say kicking the can, because we're here in California, does that mean they're putting it off?
They're
putting it off?
Yeah, putting it off.
Okay, they're kicking the can. We'll start using that around here. Yeah. So he's kicking the can. Decides to come in.
Yeah.
What are his options?
Well, so here's the thing. He doesn't want something covering his palate. And he's went to a couple places and they talked about dentures or snap-in style dentures. Now here's another thing. He plays an instrument, and so it's got to read. So he's got to have something that's fixed, or something that doesn't come in and out.
Okay.
So we talk about different options, but then he starts talking about his instrument. and can I do this? Can I continue to play if I do this? And so, for him, the idea of being able to come in and get a new set of teeth in a day, not remembering the procedure.
Teeth look good?
Yeah, not remembering the procedure.
Because of the sedation?
Yeah, because of the sedation. That's what he wanted.
And now today?
Yeah.
What about today?
Well, he's in his band, having a great time. He's smiling. I mean, when you give somebody a reason to smile, I mean, it's just like a walking billboard, Randy.
Okay.
I mean, these guys are just, smiling left and right. And all of the patients have the same regret, Randy. And that's, why didn't I do this sooner? Some of these patients, haven't liked their teeth since, high school, 10, 15, 20 years.
So it's the first time they've had good teeth.
Yeah, it's the first time they've had good teeth. And so, this is really, it's a big deal for them. So, they're doing a lot of research with this. They know their teeth are in tough shape.
Okay.
And they're looking for solutions.
And you don't like these snap-in, snap-out dentures. We only have about a minute left because you said patients don't like them. That's why you like to give them teeth that don't come out. Is that right?
Absolutely.
Is it just easier to do? Why are these guys doing the snap-ins if you say they're not as good as the other? Just because it's a little less?
It's probably a little less cost, not a lot, but a little. It's a little easier probably for some providers to kind of start there. We get a lot of patients that bring these type of prosthetics in that want to go a different route.
When you say prosthetics, what do you mean?
The snap-in, snap-out style denture. They bring these in.
You could convert them?
Yeah. So that's one of the solutions we have is the ability to convert these patients to upper lower set of teeth that don't come out.
Good. We're out of time. Final message. Okay. People are watching this, either a denture wearer or a person that has really bad teeth and gums, and they're without hope. What do you say to them? They've heard what you have to say, but they're skeptical. What do you say to them?
So we invite you in.
Okay.
Get some options. Understand the process.
Do they get to meet you?
Yeah, absolutely. Come meet me. Come, shake my hand. Let's go over some solutions. That to kind of get you where you want to be.
All right. I want to thank you for coming on the show. Yeah. Good stuff. Appreciate it. Now, if they want to make an appointment, do you prefer they just call your office or go to the website? What do you prefer?
Call the office. One of my friendly staff will talk to you, get you a consultation.
Okay.
You can go to the website and click a book now button. Okay. And get a consultation there as well.
All right.
All right. But yeah, we're looking forward to seeing these patients.
Good stuff. Thanks again.
Yeah, thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.